This is episode 326 of That Shakespeare Life. Just like the work of William Shakespeare, That Shakespeare Life is made possible by our patrons. Join us today at patreon.com/thatshakespearelife and stay tuned after the episode for even more details. Today's episode contains frank medical discussions about human anatomy, including discussion on human reproduction and anatomically correct body parts. Our conversation is not explicit, but it is medically accurate, and if you're listening with a younger audience, you may want to preview this episode first.
Hi, I'm Lucy Skeeping, broadcaster, performer, and director of the City Waits. Another great method for studying the life of William Shakespeare includes listening to this. It's That Shakespeare Life with my friend Cassidy Cash.
So after giving a few personal details about her, he goes on to say that she has had a menstrual blockage for 2 months, noting that when her period did flow, the blood had a bad watery colour, and she had very severe uterine pain, and that she felt a tearing sensation around the umbilicus, belly button.
Welcome to That Shakespeare Life with Cassidy Cash. Cassidy believes that if you desire to successfully learn or perform Shakespeare's plays, then understanding the real life and history of William Shakespeare himself is a must. That Shakespeare Life is the podcast that helps you go beyond the curtain of some of Shakespeare's most iconic works and explore the world of early modern England as Shakespeare would have lived it, learning from the writers, historians, and performers who know it best. And now, here's Cassidy.
In 1616, the year that William Shakespeare died, anatomist Hezekiah Crook published a book of medical diagrams that included a surprisingly high level of detail about human anatomy for a society that didn't yet have powerful instruments like a microscope. However, noticeably absent from his medical drawings are any anatomically correct terms for the female body. For example, Crook's drawings correctly name many parts of the male anatomy, like the epididymis, peritoneum, the penis, and the testicles. But when it comes to the female anatomy diagram, even though he has the fallopian tubes correctly drawn in the picture, he labels them as spermatical veins. In another diagram, the uterus is definitely drawn in the shape of a man's primary sexual organ, only it's labeled as a womb, with no mention of the cervix or the vagina. Shakespeare's plays give us some examples of how this level of medical knowledge was known by more general society outside of medical circles, because in his works, Shakespeare uses anatomical terms like urine as well as sperm, and even nerves and veins. So we can see from his examples that some knowledge of human anatomy was broadly available in Shakespeare's lifetime. But Hezekiah Crook's diagrams raises some major questions about not only the medical understanding of women's bodies, but exactly what kind of medical care was available for women in Shakespeare's lifetime. In order to explore the 16th and 17th century understanding of human reproduction and what the hypermasculinization of women's bodies meant for women's medicine and gynecological care in Shakespeare's lifetime, we're talking today with Roz Sklar. Roz is currently studying for a collaborative doctoral award with the University of Brighton and the Shakespeare Birthplace Trust entitled Healing Women, Early Modern Women as Healers and Their Own Texts, Practices, and Representations. Before coming to her PhD, Roz was a museum curator for 16 years, working primarily at the Shakespeare Birthplace Trust, where she was museum curator from 2010 until 2023. Roz has had a special interest in the history of medicine for many years, gaining an MA in the social history of medicine from the University of Warwick in 2006. You can find out more about Roz and links to her work in the show notes for today's episode. Hello, Roz. Welcome to That Shakespeare Life.
Hello, nice to be here.
In Merry Wives of Windsor, Falstaff makes a gross joke using the phrase, quote, pullet sperm. And a pullet is a chicken, so he's talking about chicken sperm here. And from context, he's actually probably talking about semen. This reference surprises me because sperm is only visible by a microscope. So how did people in the 16th century know about sperm when the microscope used for seeing them wouldn't be available until later in the 17th century?
Well, the short answer is they didn't. They knew what they could see, which was the seminal fluid that contained the sperm. They had all sorts of ideas about what might be in that fluid. But it's commonly referred to as a man's seed, and there was an understanding that a woman also produced seed. So the word seed here is important because it clearly relates to an understanding that things grow from seed. One of the major theories of conception was that during sex, both parties produced this seed from their stones, which is the word for female ovaries and male testicles. and it mixed or commingled in the womb, and that's how a child was conceived. So the act of conception and subsequent pregnancy was talked about in the language of the garden or the field. It's like cultivation, got this agricultural sense to it. Interestingly, this theory led to the idea that twins could be the product of two separate acts of conception, potentially with two different fathers. As you've said, it wasn't until much later in the 17th century that Antony van Leeuwenhoek first observed sperm using a microscope. And the actual mechanics of conception weren't understood until the 19th century.
In the side-by-side diagram of the male and female reproductive system, the uterus is shaped definitely like a penis, and the fallopian tubes are labeled as spermatical veins. This was very surprising to me. And Roz, I'm wondering, why is there not a distinction made between male versus female body parts, especially when they literally have them laid side by side to compare? I mean, this is a little macabre, but they were doing dissections of corpses to see the insides of these people when they were drawing these diagrams. So they're literally looking at it and then still drawing it as a penis. Why are the parts not called different things based on male versus female when visually they're obviously not the same body part?
So I think I'll have to preface my answer by saying there's a huge body of work on this, and we'll only really be dipping our toes in the water. But what you're responding to in the image is, like you say, is the observation that the male and female genitals and reproductive organs look similar. So the vagina is an inverted penis, the ovaries like embodied testicles, whereas the uterus was actually thought to be a sort of interior scrotum. It's not a great comparison, but that's what they thought. So not only the names used to describe some of the female parts appear to be particularly male to our modern eyes. So there's this sort of masculine description of female anatomy. So this has come to be known as the one-sex model, and it was based on the anatomical observations of the classical physician Galen of Pergamon, whose theory of medicine was dominant from the 1st century CE well into the 16th century and beyond. Galen never actually dissected a human body, though, as far as we know. His anatomical observations were made through the dissection of animals, and especially Barbary macaques, which he considered to be the closest things to humans, anatomically speaking. So the one-sex model was essentially an understanding that female genitals and reproductive organs were inverted versions of the male, and that not only was there a visual similarity, but more importantly, there was ultimately a functional similarity. And Galen's theory of the one-sex model was supported by perhaps the most influential anatomist of the 16th century, Andreas Vesalius, who died the year Shakespeare was born in 1564. And he was the chair of anatomy and surgery at the centre of anatomical research at this time, the University of Padua in Italy. And he published an incredibly influential work on anatomy called De Humani Corporis Fabrica, or On the Fabric of the Human Body, first published in 1543. And Vesalius is often referred to as the founder of modern human anatomy, and he advocated for the vital importance of anatomy to medical education, that doctors in training should be carrying out dissections themselves or directly observing the dissection of human bodies. And though Vesalius disagreed with Galen on some things, he did concur with the one-sex model. But you mentioned Hilkiah Crook earlier, and though he does publish these illustrations as part of his text, he actually ends up in his conclusion agreeing with the eminent French physician André de Laurent, who's born in the middle of the 16th century, who opposed the dominant one-sex model, saying that the genitals of the two sexes are different not only by location, but also by number, form, and structure, which, though it may not seem a lot, was a significant departure from the dominant theory that had been around for over 1,000 years. So how far this one-sex model can be taken is and was then a matter of debate. So there were theories floating around to support it at the time, that if a woman's reproductive organs fell out or descended for any reason, I think there's an anecdotal story of a woman jumping over a fence and her penis falls out of her body, then at least her reproductive organs would appear like a man's on the outside of her body. But how prevalent this theory was is a matter of debate. So whether it can be taken to the extreme of then the woman would turn into a man because that has happened. It actually doesn't seem to preoccupy medical writers at the time. They don't spend an inordinate amount of time warning people against it. So the second half of the 16th century into the 17th century is a really important time in anatomical study of the human body. And the advances that are made in anatomical understanding in the 17th century moved us much further on in our understanding than we had come in the previous sort of 1500 years or so since Galen. However, it does take time for these discoveries to trickle down. So Vesalius published in Latin, and many medical texts were still published in Latin So texts in the vernacular were on the rise in the second half of the 1500s and certainly into the 1600s. So it takes a while for these new anatomical ideas to become embedded in public consciousness. And it also takes time for them to impact on the dominant Galenic theory of medicine. So in England, for example, this theory, rather than the new anatomical knowledge, is key to medical practice.
So I want to make sure I share this correctly, because when I made the statement about anatomists basing their drawings on humans, I thought I was sharing something I knew, but your response disagreed with me that Galen was actually basing his work on animals for his drawing. So I want to make sure I'm sharing this correctly. When you mentioned Vesalius, and then we've also talked about Helkiah Crook's drawings, would anatomists have used real people for the basis of their drawings at any time? Or when we look at these drawings, like Helkiah Crook's that we're talking about today, should we assume these drawings were based on Galen's work with animals? Or would any of these anatomists have actually done, I guess, primary research would be the way to say that?
Yeah, absolutely. So Vesalius did dissect human bodies, and he really advocated for the dissection of human bodies and how important that was. But this wasn't made possible until around the 13th century, when it was first made possible with Emperor Frederick II of the Holy Roman Empire, allowed for one body every 5 years could be dissected for the education of physicians and surgeons. By the 1400s, this has increased, and when Vesalius is working at Padua in the later 16th century, there are more bodies available. Bologna, in particular, seems to have been a sort of popular place for dissecting bodies in the later 1500s. And in England, you start to get people being allowed to anatomize bodies under Henry VIII. So sort of around the 1530s, I think he first allows the College of Barber Surgeons to dissect human bodies. So yes, this is part of the advancement of anatomical understanding at the time, is that they are now able to dissect human bodies.
Well, now that we've discussed their understanding or lack of understanding of what the body parts were and where they came from and how they all fit together, and as well as their perspective on reproduction and how that occurred, I want to talk a little bit about contraception, because I've read about early modern condoms, so I know some types of contraceptives were available, but what was understood about how pregnancy occurred and what options were available, and were there any contraceptives available to women specifically?
So contraceptives were obviously controversial because of religion. So sex was not supposed to take place outside of marriage, and if you were married, then you were supposed to be having children. So there was never a point where the church sort of was happy about people using contraceptives. But like you say, there are early examples of condoms made from animal products such as lamb or pig intestines or leather in the early modern period. Gabriel Fallopio, who the fallopian tubes are named after, developed a sheath made of linen and soaked in some kind of medical concoction. But this was really supposed to be worn after sex to guard against venereal disease. It wasn't really intended to be worn to prevent pregnancy. In terms of when you had become pregnant, or you thought you might be pregnant but you didn't want to be, there were known abortifacient herbs. So people, under humoral theory, the idea that the body contains the four humors of blood, phlegm, black bile, and yellow bile. Health relied on a good balance of these humours, and medicine's aimed at bringing the humours of the body back into balance. So medicines were made up of a variety of plants and minerals known as simples, which all thought to have different qualities or virtues. And it was known that certain plants could have an effect on pregnancy. So we know this because published texts in English mention them, as do manuscript receipt books or recipe books that were created by women. There might be a mention of a herb that provoked the terms, which means it triggers menstruation. And that this is an indicator that it might trigger an abortion or cause miscarriage if someone was pregnant and didn't want to be. So you sometimes have these sort of euphemistic recipes that on the surface are advertised as being to restart periods that have stopped, which was in itself thought to be a medical problem. But underneath, there's this understanding that they would also abort an unwanted pregnancy. And that was really one of the only options for pregnant women, and not one that was either very reliable or very safe.
Are there any primary records that tell of women being medically treated for conditions like ectopic pregnancies, uterine cancer, ovarian cysts, or other obstetric or gynecological conditions? And if so, what were their suggested treatments in these cases?
So yes, absolutely. I mean, we do have to be a little bit careful when we're talking about medicine in this period, that we are aware of retrospective diagnosis. So that's taking a disease or disorder that has been classified in the modern era and trying to apply it to illness that was experienced or described in the early modern period. Ectopic pregnancy had been observed and written about as early as the 10th century by the Arab physician Abul Qasis, who observed a type of ectopic pregnancy known as abdominal pregnancy. In this period, such pregnancies would have been very dangerous and commonly fatal, and there would most likely have been no post-mortem, so there's no way of knowing how many women died due to ectopic pregnancy. When it came to cancer, medical writers used the word cancer, which is Latin for crab, to describe tumours because they thought they looked like crabs. But again, there's no way of knowing how many observed tumours were actually cancer in the way we would define it today. And some could have been cysts or benign growths. So what we have to go on most often are described symptoms. If we look at the case notes left behind by Shakespeare's son-in-law, the physician John Hall, Hall was married to Shakespeare's eldest daughter, Susanna, and he practiced medicine in and around Stratford upon Avon in the later 1500s and early 1600s. He died in 1635. So one of his cases is that of Mistress Fines, a 22-year-old woman Hall treated. And Hall always starts out with a description of the patient's symptoms. And he starts out on Mistress Fines with these words: melancholy from the womb, white discharge with uterine pains. So after giving a few personal details about her, he goes on to say that she has had a menstrual blockage for 2 months, noting that when her period did flow, the blood had a bad watery colour, and she had very severe uterine pain, and that she felt a tearing sensation around the umbilicus, belly button. And the patient also reported shortness of breath, dizziness, a white flux, meaning a white vaginal discharge, and abdominal pain. Now, Hall doesn't attempt, and rarely does attempt, to diagnose this condition. He's satisfied with listing the symptoms. And when he undertook his treatment of Mistress Fines, his first prescription caused her periods to start again in laudable quantities. And she wrote to him to report that she had expelled large fleshy masses like liver from her womb with pains as if in labour. So looking at that with modern eyes, that looks very like a miscarriage, possibly one that started as an ectopic pregnancy. But I think we understand more about medicine in the period if we're happy to sit with the words that they used and the descriptions and definitions they had, because it's more revealing of their theoretical understanding. So the bleeding and the passing of the fleshy lumps would have been welcomed by the physician and patient, hence why Hall uses the term laudable, because it's thought of as the bad excess of blood which is causing the illness leaving the body. And this purge of excess blood and matter leaves the body clear of corruption and able to recover its balance. So Hall's subsequent treatment aims at cleansing the womb and restoring the liver to health. And he uses standard Galenic treatments that are based in herbs and minerals. But we can't move on from this question without talking about certain female conditions which are not so recognisable for our modern ears. And the main one of these that I want to talk about today was what was called suffocation of the mother. And this is a condition of the womb, so it's a uniquely female condition. The English physician Edward Jordan wrote a short book on the suffocation of the mother that was first published in 1603. Jordan had obtained his MD from the University of Padua in Italy, which I mentioned earlier, and he practiced medicine in London and Bath. This condition so the suffocation of the mother had been known about for centuries, but it would be a whole podcast in itself to talk about it. So I'll just try and summarise it as briefly as possible. So there was this idea that the womb was particularly sensitive when it came to women's health because it had direct anatomical links to most of the major organs of the body. So not only did it have its own medical conditions that originated in the womb, and the womb is the perfect incubator for growing things, but any other disease or illness from somewhere else in the body could affect the womb. So medical writers use the word sympathy and consent to describe this kind of connection between different parts of the body. One of Jordan's main aims in writing about it actually is because he believed that it was commonly mistaken for demonic possession by credulous, superstitious people. And he points out that as far back as Hippocrates, it was known to have had what he calls natural causes. So the symptoms of suffocation of the mother were things like fainting, convulsions, and fits, predominantly this sort of choking feeling. Jordan describes it as, quote, an effect of the womb wherein the principal parts of the body by consent do suffer diversely according to the diversity of the causes and diseases wherewith the matrix, which means the womb, is offended, end quote. So if the womb is unable to naturally expel whatever is offending it, then these symptoms will ensue because the offence is communicated from there to the rest of the body. So I mentioned some symptoms just now, but Jordan says that actually there is such a variety of symptoms that can affect just about any part of the human body. It's a very broad-ranging condition. So how did they go about treating it? So one of the things they did, it was this based on this idea that the womb was sort of sentient in that it responded to external stimulus and could respond particularly to smell. So they didn't think it actually had a sense of smell, but that it did respond to smell. And treatment aimed at bringing the womb back into its proper place. So part of suffocation of the mother is the womb is kind of rising up, and that's why you get this choking sensation. So women were told to smell horrible things like burnt hair or burnt horse hoof, and then a sort of nice smelling ointment would be applied to the vagina, and this would encourage the womb away from the nose and back down towards its proper place. So that was the physical approach. But Jordan also writes about one of the possible causes being perturbations of the mind. So he recommends kind of counselling as well. So if it's triggered by jealousy, then he recommends good counsel and persuasion. There's a very strong link very far back to ancient Egypt between the womb and these sorts of symptoms, hence the term hysteria being taken from the Greek word for uterus, hystera. And the symptoms could be quite alarming, and possibly things like epileptic fits were confused at the time for suffocation of the mother. And Jordan certainly believed that it was commonly thought to have some kind of supernatural cause, though he doesn't believe that himself. But what's interesting to throw in at this point is that even though suffocation of the mother was thought to be a uniquely female affection because of its origin in the womb, Shakespeare afflicts King Lear with it. So in Act 2, Scene 4, Lear exclaims, "Oh, how this mother swells up toward my heart, hysterica passio, down thou climbing sorrow, thy elements below." Hysterica passio was another name for suffocation of the mother. And I'll leave that with your listeners to make sense of that, because I've never really been able to understand what
So write us, please, if you have if you have theories, we'd love to hear them.
Yeah.
And I don't know, I'm with Jordan. I think when he says that he believes that the uterus was susceptible to demonic possession, any woman who has ever gone through a difficult period or a difficult birth is inclined to agree with him on that one. This next question is related to medical care for women, and it was submitted by a patron of our show who wants to know whether or not menopause was understood or treated medically during Shakespeare's lifetime.
That's a really great question. So menopause itself is a 19th century word, but of course it's widely known that when women reached a certain age, their periods would stop. I haven't personally come across much that suggests this was thought of as a medical problem. It was probably thought of as a natural process. Even recipe books compiled and kept by women, as far as I'm aware, don't mention it that much. To put it in humoral terms, unfortunately, menopause was seen as the natural process of the body becoming colder and drier as it aged, kind of a desiccating process. Not very flattering.
No, not at all.
So, and this links back to the idea of menstruation itself being understood as being part of the process of conception. So the extra blood the woman's body creates was supposed to nourish an infant in the womb. And when the infant was not conceived, then all of that excess blood had to go somewhere, otherwise it would cause health problems. So it was released through menstruation. And a cessation of periods at any time that was, if you were sort of an age where you were supposed to be having them, was thought of as a health problem. But menopause actually might have been considered to have given women's bodies a little bit more balance, because they're not anymore creating this excess blood and then releasing it every month.
Where do we go to find the phrases for the menstruation process? What do we look for in these books? Were they calling it a period, or would they have called it menstruation? What was the word?
The word I've come across the most is the terms. They call
just the terms.
Like
okay.
The terms, yeah. That's the one I've come across the most. There's probably other words for it.
Oh, there's so many etymological questions that brings up for me, like coming to terms with something, for example. Anyway, yeah. I have no idea if that's actually connected. Don't write me and say that it isn't. That was just a thought I had there. Now, midwives had a better understanding of the female body than the men serving as physician in this period, obviously, based on these diagrams. But were midwives, therefore, essentially the 17th century OBGYN?
In a way, yes. I mean, they are primarily responsible for childbirth in this period. So they're responsible for overseeing childbirth. There were male midwives, but not many. Midwives could be anybody sometimes. So if you lived in a very small village that was quite far away from a town, for example, then you might have to rely on just a neighbour who happened to have some experience of childbirth. But at the other end of the scale, there was a licensing process for, let's say, professional midwives. You had to be licensed by the bishop to practice. And this required a woman to prove that she had experience and skill. And it required her to bring testimonials from women she had assisted in labour. She also had to take a midwife's oath where she promised to do no harm to mother or child, to ensure that all children were baptised, especially if it looked like they wouldn't make it to a church baptism. The midwife was responsible for baptism. And also to ensure that any stillborn infants were buried properly. She also promised to take on the important role of witness to birth, and this is where you find a lot of midwives in Shakespeare's plays. And it's particularly important when it comes to illegitimacy cases, because she's in a position where she can talk to the woman in labour and extract from her the name of the father of the child. And this becomes important when parishes have to pay for illegitimate children and support them financially, so they need to know who the father of the child is. They don't tend to have any formal anatomical training. Remember, a lot of anatomical texts are in Latin. Women are not allowed to attend university. They're not allowed to attend anatomical lectures. But anatomical texts, as we've seen, were available to those who could read in the 16th century. And even if you couldn't read, you could be read to. And there were obviously pictures and diagrams in these books as well. An experienced midwife would have lots of birth experience, and she would have learned different techniques. So we know they had techniques for turning a breech baby in the womb, or how to extract retained placenta, and also to know what the danger signs were during labour and when they might have to call in a surgeon to assist with the delivery. And they also probably had a good knowledge of ante and postnatal care, things like treatments for mastitis and that kind of thing.
Well, what does this mean the medical landscape was like for women in Shakespeare's lifetime? Were there options for medical care, or was there anything like a medical specialist, or was just a doctor at this time?
There's loads of variety in medical provision at this time. It's very different from today. So there's certainly no effective nationwide regulation of medical practice in England, and there's also no uniformity of medical education. But historians have identified certain groups of practitioner. So first you have physicians, and they sort of see themselves very much top of the tree. They're kind of the consultants of the early modern period. They had to be university educated. They could be licensed either by the bishop or, particularly in London, by the College of Physicians. They saw themselves as very much the elite medical practitioners, and they wanted a monopoly on the internal conditions and internal medicine. And their education was very heavily influenced by Galenic medicine. Underneath them are the surgeons. Surgery at this time had in some ways a much wider remit than it does today, and sometimes in some ways narrower. So in Shakespeare's plays, you might find surgeons on the battlefield where they're fixing up wounds, but they would also treat broken bones, skin diseases, dental problems, wounds, things like that. They're also supposed to be licensed to practice, and they organise themselves much like other early modern crafts or trades into companies. So in London in 1540, you have the Company of Barber Surgeons, which brings these two trades, which had been very closely associated for a long time. It brings them together, and they don't separate again until 1745. Whereas in regional towns and cities, surgeons actually quite often are grouped together in companies with other skilled trades, things like tallow chandlers and things like that, things you might not expect to have anything to do with surgery. And then there's apothecaries. So there's famously an apothecary in Romeo and Juliet. They're often referred to as sort of the early modern pharmacists, and this speaks to their role in providing the ingredients used for medicine. So in London, then they're actually part of the Grocers' Company until 1617. So that really shows that they're supposed to just provide the ingredients. They're absolutely not supposed to diagnose illness or come up with their own kind of medicines, but a lot of them do, and especially. I mean, we know they do in London because they get in trouble for it all the time. But in rural areas where you might only have an apothecary, they might be helping people out medically as well. There's the midwives, who we've talked about. And then there's the staff of medical institutions, such as hospitals or lather houses. And there's also ordinary women who are paid by poor law authorities to nurse the sick. So in post-Reformation England, there was a bit of a gap in welfare provision, which is taken up by the parish authorities. And you do see payments by overseers to women for nursing, especially in the 17th century. And then there's a whole host of other practitioners who haven't really been able to be identified as belonging to one particular group. They don't quite fit the model or requirements of one group. And these can be quite famous, well-known practitioners, such as Richard Napier, all the way down to your town mercer who might sell medicines on the side, or the village wise man or woman who was known to have particular skill with herbs or had gained a reputation for healing a certain type of condition. So what's important to think about is that the medical theoretical knowledge they're all working with is the same. There's nobody who has a type of medical knowledge separate from the physicians. They're all Galenists predominantly, and they're all using that theoretical framework. So it's just the level of knowledge of that differs, possibly.
Roz's work looks specifically at women who practice medicine. Roz, who were the women that would have been operating in any of these medical categories you've just mentioned for us for the 16th and 17th century?
First off, it's really important to point out that domestic medicine is very much the first port of call for anyone suffering in this period. And the households of the upper classes especially could provide a wide variety of medical treatments and perhaps some inherited books of recipes that are written down and passed from generation to generation. And not only that, but there is evidence that people, if they were unhappy with the treatment they had from physicians or other doctors, would retreat back to domestic medicine or try a bit of this and try a bit of that. So they weren't always only consulting physicians, but they would shop around and try different things. Primarily treatment by physicians and treatment by a woman at home would use the same theoretical knowledge, as I've said. So they're using the same kinds of ingredients. And some women we know had really particularly developed knowledge of medicine. So at the extreme end of this domestic medicine spectrum, you have people like Lady Grace Mildmay, who's born in 1552, Lady Margaret Hoby, born in 1571, and Elizabeth Grey, Countess of Kent, who's born in 1582. So both Mildmay and Hoby left manuscripts that reveal the extent of their medical knowledge and practice, and the Countess of Kent's recipe book was published posthumously and went through 22 editions. But these women are practicing medicine charitably as part of their duty of care to their households and the people who lived on their land. Lady Mildmay says that she was educated in physic by an older female cousin. So again, you have this idea of female medical knowledge being passed down through the generations. And both Mildmay and Hoby have links to male practitioners, and they read medical texts, including herbal. We also have evidence of women being licensed to practice surgery. They are in the minority, and their licenses often limited their practice. But A.L. Wyman has found that of 850 licenses to practice surgery issued by the Archbishop of Canterbury between 1580 and 1775, 7 of them were to women. That's not a very large number, but it might be indicative of a larger number of women practicing surgery who weren't licensed. It could be sort of a tip of an iceberg effect. There seem to be particular conditions, one in particular called scald head, which is perhaps related to a venereal disease that is often treated by women. There's also other practitioners who are less easy to define as a group, called herb gatherers or wise women or other less flattering names. But we know of their existence because, for example, they crop up in the annals of the College of Physicians because they're being punished for practicing without the consent of the college in London. But some of these people would have been quite successful in their practice, and they continued to practice, going against the censure of the college for doing so. And some of the London hospitals directly employed them for treating skin diseases. And Margaret Pelling has found that in the city of Norwich, women are practicing medicine in lazar houses. There's also evidence that some women may have carried on their husband's medical practice after his death. And then there's the area that I'm looking at in particular. It's mainly looking at the 17th century, but there's a system of parish or civic welfare provision that employs women for various services, including caring for the sick. So in London, there's quite a developed system of parish nurses by the end of the 1600s. Rochelle Monkhoff has looked at the searchers for the dead of the 16th century, who particularly tasked with identifying people who may have died of plague. But she's identifying that the church wardens are also paying women to nurse the sick. So it looks like from the 16th century all the way through the 17th century, there are women who you might not expect, you might not describe them as specialists or or doctors in any particular way, but they are carrying out these nursing services and looking after sick people.
Speaking of husband and wife teams, Shakespeare's daughter Susanna is known to have assisted her husband John Hall in his apothecary practice. But Roz, was Susanna one of these medical practitioners in her own right, and did she treat women's issues?
It's certainly really interesting to consider how much involvement Susanna might have had in Hall's medical practice. And I think there are a few things to think about here. So one is that she's living with John Hall, who had an active and far-reaching medical practice. Susanna could very probably have learned something from him or from his work, and she could well have come into the marriage with medical knowledge of her own gained from her female relatives. Secondly, it's clear from Hall's surviving case notes they often travelled away from home to visit patients, and there's no direct evidence of him having an assistant or an apprentice to carry on his practice while he was away. So it's not beyond the realms of possibility that Susanna could have learned medical knowledge from Hall and may have been called upon to carry out some of the responsibilities of his practice when he was away. There are also some recipes that Hall resorts to fairly frequently in his practice. One is a steeled wine, for example, that could easily have been made at home, possibly by Susanna. And her epitaph seems to support this view. So this is something that Dr. Ailsa Grant-Bergerson and I have discussed as part of the AHRC-funded project, Susanna Hall and Hall's Croft. So Ailsa pointed out that the wording of Susanna's epitaph could well indicate her participation in medical practice because it mentions her comforts cordial. And there could have been a double meaning intended in comforts cordial. The idea of cordial as relating to the heart, precursor of our modern cardiac, was established by the 17th century and denoted warm, generous, kind feelings. And at the same time, it was used in early modern medicine to mean medicine, food, or drink that invigorates or stimulates the heart. So it gives us something to think about anyway. And I don't know whether she would have, even if she was involved, would have restricted herself specifically to female patients, but we'll never know.
Obviously, as you have mentioned, we have just touched the tip of a huge iceberg here with a lot of history that deserves to be unpacked in context of this conversation, which we would love to hear your advice on. When we want to explore this topic further and dive deeper, where should we start? What are some of your favorite books or resources you can recommend we use to learn more?
I mean, I should mention, because we've just talked about Susanna Hall, Greg Wells' book, John Hall, Master of Physics, is a complete translation of Hall's surviving Latin case notes. It's a really interesting book, tells you a lot about Hall and his practice. In terms of general medical history, a really good person to start with is Roy Porter. He published a lot on medical history, especially from the patient's perspective. He wrote a book called Blood and Guts, for example, which is a short introduction, short history of medicine. And when it comes to women's practice of medicine, I can't recommend enough Margaret Helling's work. For example, her book of collected essays, The Common Lot. It's a really great place to start to learn about sort of the sort of extensive variety of work that women were involved in when it came to medicine.
These are excellent resources for sure. And Roz has shared a great list of resources with us today that was too long to share in full here on the audio, but we will list the entire suggestions on how to learn more on Shakespeare and the practice of medicine, as well as some primary documents of the doctors we've mentioned, and more on John Hall and so much more, all in the show notes for today's episode. So stay tuned for the URL for where to find all of those. Now, Roz, we ask everyone this next question here at That Shakespeare Life, and that's, what's the one book you would take with you on a deserted island? My friends in England tell me I'm supposed to allow you the complete works of Shakespeare and a copy of the Bible, so your choice would be in addition to those.
But this is such a hard question. It's really hard. I've got to choose probably the only book that I have read more than once and can also seeing myself continue to read, and that's Jane Austen's Pride and Prejudice. It's the perfect novel from my point of view.
The perfect novel. What a large compliment. Although I'm hard pressed to disagree with you there. It's a very good one. I think that's an excellent selection for your desert island choice. So what's next for you? What are you working on now that you're excited about?
So at the moment, I'm working on my PhD, healing women, early modern women as medical practitioners in their own text, practices and representation. So I'm deep in archival research for that. I also continue to work with Ailsa and be involved on the AHRC-funded Susanna Hall project with Dr. Ailsa Grant-Bergerson and the Shakespeare Birthplace Trust. After the PhD, who knows, I was a curator in the museum sector for many years before I began my PhD, so I'm hoping to be able to get back into museum work and sort of use my research to bring those two things together.
That is very exciting. We look forward to you achieving that PhD and wish you the very best with that progress. I know digging through the archives is a fun time to be at. And thank you so much for being here with us today to introduce us to the understanding of human anatomy from Shakespeare's lifetime, as well as helping us to see clearer some of the depth of references to medicine and women's issues when we see them come up in Shakespeare's plays. We really appreciate you taking the time to share this with us.
You're very welcome. Thank you for having me.
Find links to the resources mentioned in today's show, along with more information on our guest and how you can follow her work in the show notes for today's episode at CassidyCash.com/episode 326. While you're on the show notes page, if you would like a more in-depth look at some of the diagrams we're talking about today from Helicaya Crook's work, as well as Vesalius and DeLawrence and others, we have them all packed into our patrons area on the show notes page. When you visit the show notes page, you'll find a Become a Patron button. You can use that button to either join us as a patron or log in if you're already a supporter of our show. And all these extras will expand right there on the show notes page. Again, that URL is CassidyCash.com/episode 326. That's CassidyCash.com/EP326. That Shakespeare Life is made possible by listeners just like you who sign up to be our patrons. Patrons of our show get unlimited access to all of our detailed show notes, including 150 additional episodes of our show not available anywhere else. Along with all of these extras, you get special insider history, like a video library, animated versions of Shakespeare's plays, and a collection of educator resources that let you take our podcast right into your classroom. Find out more and explore all the history right now at patreon.com/thatshakespearelife. That's patreon.com/thatshakespearelife. That Shakespeare Life is researched and produced by me, Cassidy Cash. Our audio engineer is Gary Mayholm. That's it for this week. Thank you for listening. I'm Cassidy Cash, and I hope you learned something new about the Bard. I'll see you next time. Bye-bye.
Thank you for listening to That Shakespeare Life. As always, the best conversations happen after the episode over at CassidyCash.com. Become a part of a vibrant Shakespeare conversation by adding your voice over at the website. Until next time, remember, when you want to know William Shakespeare, you have to go behind the curtain and into That Shakespeare Life.